definitely, if you're worrying, you're not going to be able to attend to classroom tasks, especially if the classroom task is not interesting enough to grab their attention from their worries. Okay? It's going to interrupt your thinking, right? You're not going to be able to go on Jeopardy if you're worried about someone, unless you don't really care about that person. Okay? It's going to affect your decision making because it's compromising your executive functioning. Your frontal lobe, your executive functioning, your ability to process information, make effective decisions. Okay? And it will definitely interfere with your perceptions of your environment. Again, if your antennas for danger is up, you're going to be more hyper alert for any other potential dangers there may be out there. There may not just be one saber-toothed tiger. Okay? So all of these factors interfere with a child's learning and concentration. So if they're not able to attend to you or the material that you're presenting them with, it may be because they're ruminating over some worries that it's bothering them. Yes?
I've had children who I feel like with anxiety disorders who I feel like have kind of gone the opposite way and sort of they've sunk all of their anxiety and worry and whatnot into the work. So children who are receiving straight A's, children who are almost hyper-performing, so it has affected them in an adverse way.
Okay. You may actually be talking about perfectionism, which is a fear of being imperfect.
Is it on the spectrum? Is it on the anxiety spectrum? Or is it often coupled with an anxiety disorder?
Absolutely.
Okay.
So they may be, actually, for those kids, they may actually be spending more time perfecting their work, doing and redoing and editing and
procrastinating and erasing and redoing.
Exactly, procrastinating. Why do you think kids procrastinate, especially perfectionists? Why do they procrastinate?
Well, perfectionism doesn't exist, so
Never gonna be good.
if I fear of failure, I can't.
Well, should I redo it 10 times? Should I redo it 50 times? If I wait until the day before, I'll only redo it 10 times. If I do it a week before, I'll redo it 50 times.
I will fail.
Okay, my attention span is just now diverted everywhere. Okay, so basically, a lot of your procrastinators are actually perfectionists. And the reason being is because they want everything to be perfect. And we all know that perfection doesn't exist. No matter how you do it perfectly, it's still going to be not perfect. That's just an irrational idea. Okay? So, because they want it perfectly, they basically see the task that's given to them as this huge mountain of work. Okay? And what they need to learn is how to break that mountain down into what I call little molehills, so that they're able to visualize each of those little tasks as completable goals. So it's the same thing as when your teachers gave you a 50-page paper. If you didn't get a 50-page paper, lucky you. It's the same idea. What in the world am I going to write 50 pages off? Right? So then I start breaking it down to chapters. Just like any book. I break it down to different chapters. Within the chapters, I break it down into sections. Within each section, I break it down to paragraphs. It's the same idea. With a perfectionistic child, that child has difficulty breaking the tasks down, which is why I'm going to procrastinate, because it's this mountain of work, and who in the world wants to attempt spending all their weekend perfecting this work? Okay, so it's a lot also of a organizational skill, mental organization skill as well.
And sorry, just kind of going back to the child with that, I feel like it's rewarded a lot. The teachers are, wow, you did 12 pages.
Oh, absolutely.
How, as a teacher, would would I actually have quite a few of these children, how as a teacher would I,
Tell them to do their work imperfectly.
so maybe try to get a B on this next time, that type of thing, or what do you mean? What does that look like?
Well, you know, the thing is you have to be careful too, because you don't want to reward
Exactly, right,
inadequate work.
right.
So, you can give them, for example, let's say if I want you to do 10 pages, if you go over 10 pages, I'm not reading that last page.
Right.
Okay? Now, I remember when I was in school, I would change the fonts and the line spacing to fit everything in. Okay? So, I don't think it makes sense to just throw a task at them and tell them to do it perfectly. You have to start small. So for example, giving them a problem to solve and say, I just want you to solve 5 of them the way that you know how, and 2 of those problems, I want you to actually solve it wrong. Let's see how wrong you can do it. You know, so do it small. Don't start big.
Can
Okay?
you time them? Does that work? Like if they're spending 5 hours on their homework?
Absolutely.
Can you say,
Yes.
you spend 20? Okay.
What I usually do with my kids who come in with that perfectionistic tendency is I actually have them bring in their work and we break the tasks down. Okay? For my college kids, I have to bring in their syllabi and I have them break down each task. And then I have them schedule it in their planner. So from this time to that time, we're going to work on this chapter. From this time to that time, we are going to work on this paper, this section of this paper. And if we're actually using a timer now, and if you go over that time, you're going to have to stop and go on to your next task. Because a lot of the problem there is also a sense of completion. That I need to have this part completed before I can move on to the next. So that you work on start, stop, start, stop. Yes? Just quickly 2 more questions and then we'll move on.
How do you distinguish this from ADD then? Because it seems like the symptom is quite identical, where they can't focus because they're terrified.
Absolutely. Dr. Paxson will actually be talking about that in a second.
I
Yes.
just have a question about how to manage perfectionism with students within the classroom, not a therapeutic situation. But for instance, I had a student who, when she would get a 96 or a 98 on a test, would have a fit, would really have a fit. Many of us, I see a lot of nods around here. What do you do with kids like this? I mean, how do you?
You have to understand that it doesn't just start at the school. You have to work at it systemically. So even if you tell her, you know, 98 is good, she's probably being reinforced somewhere else that it's not good.
So how do I deal
Enough.
with this as a teacher?
As a
When she's
teacher?
having, you know,
Well, I would consult with her parents. What's going on in the family?
difficult things.
Difficult things.
You know, usually there's some sort of, there's some anxiety, outside anxiety.
With
but
the
I'm wondering,
parents?
The one situation I'm thinking of, there was just a big custody battle.
Oh.
So it was, you know.
Now you're bringing on a whole sword of other
I know,
dynamics.
but I think
That's
this
going to
is-
take another 2 hours to address.
Yeah, except that I think that these are the kinds of things that we're dealing with in our classrooms, that we have kids who come in and we're not therapists, and yet they're breaking down in our class.
Right.
And what are the things?
Well,
something that
first
you
of
can
all-
immediately deal with?
Well, what Dr. Paxson is actually going to go over some tools that you can use with your kids. However, you have to understand with these more deep-seated issues, you have to refer them to a specialist who understands and knows how to treat this.
Right, and when we've done this, because I think we all come from schools where there are psychologists and therapists and good referral services and he's helping us.
Yeah,
And I guess I'm just asking, like, then.
That's a whole different story again.
Right.
Well, you know, unfortunately, with it's the same thing as any medical field. Okay, you have your general practitioner. That's basically your general psychologist. They treat everything and anything under the sun. Okay? If you have a heart disease, are you going to go to your, if your child has a heart disease, are you going to send him or her to the pediatrician, to the general pediatrician? And let the pediatrician treat your child? No. Who are you going to send them to? A cardiologist, not just a cardiologist either, a pediatric cardiologist, right? So you have to understand that you cannot view all psychologists under the sun as well. That within this, the psychiatric field, you have your general practitioners and you have your specialists. So if someone comes in to me, brings a child with bipolar disorder, it's not ethical for me to treat this child because I would have absolutely no clue what to do with this child. My role would be to refer them to someone who is specialized in that. Now, I can't say that all psychologists are going to be ethical and do the same thing. However, if I am given a case where it's not my area, and I've been working with OCD and anxiety disorders since the 90s. And I know OCD and anxiety inside out because I had OCD as a kid. And I was never properly treated because my parents took me to the pediatrician. They had absolutely no clue with me. They just thought I was an eccentric child. And I was never properly referred. Nobody knew what to do with me. Okay? So I had to manage that on my own until I was in college, and one of my professors pointed it out to me. You've got compulsive tendencies, because I was doing a read and rereading and rereading to make sure that I have it just right, making sure I didn't miss anything, amongst many other compulsive behaviors. Okay? So definitely refer out. You can come talk to me at the end, and we'll discuss a little bit more. Because we are short of time, I want to turn the floor now to Dr. Paxson, who will discuss the differences of what to do with a child. Okay?
All right, so, sure, that'd be great. So the first thing we want to do, and I think someone over here had asked this question, which is perfect lead in. We want to distinguish when we see a behavior, how do we know if we can attribute it to anxiety or if we can attribute it to some sort of other misconduct, like ADHD or behavioral disorder. So just because ADHD is so common, I did side by side so that we can see some of the symptoms between where we might see a child with anxiety exhibiting these symptoms in the classroom and a child with ADHD exhibiting these symptoms in the classroom. So what you'll be able to see, especially as we go through some more of these slides, is that there's a lot of overlap. So how do we tease apart when both a child with anxiety and with ADHD is going to keep to him or herself? How do we know what to attribute that to? And what we need to keep in mind at its core is that even though there's a lot of overlap between these symptoms, and if we're filling out just a basic checklist, so check this off if the child exhibits these number of symptoms, we need to go dig a little deeper. Why is that child exhibiting these symptoms? And so you can ask the child some follow-up questions, get a really good history. If you have a relationship with the parents, try and figure out what's going on with that child that they may, for example, keep to himself. So a child with anxiety may be keeping to him or herself because of the social phobia component. Because it's just, there's so much on their mind that they're attributing to danger when they interact with other people that it's easier, it's simpler to stay by themselves. A child with ADHD is probably keeping to themselves because they're oblivious. A lot of times they're just happy to be with a group, but they may not be the favorite kid in the class because they have some odd behavior, so okay, we'll be on their own. Another thing, we see an overlap here with the difficulty paying attention, and I just want to hammer that in, the differences here. So A child with anxiety is having difficulty paying attention. Why? Exactly, because they've got these thoughts, the worry thoughts going through their head that always go back to some sort of danger. So your fight or flight response is activated, and we know that when the fight or flight system is activated, there's no room to pay attention to anything else. You're in survival mode. They perceive a danger that their life is at risk. Essentially, their antennas are misperceiving the situation. So they're having difficulty paying attention for that reason. Child with ADHD is having difficulty because they've got some deficits in their frontal lobe that make it difficult to concentrate. Okay, so here's another. So here are some more symptoms, and we can see them side by side. And actually, you guys are asking really good questions because we've already touched on some of these. So for instance, a child with anxiety may be behind in work because of that procrastination piece that we talked about, also tying into the fact that they're spending an inordinate amount of time on work. They want to get everything just right. So their anxiety is going to be up here until they get that just right feeling. It's finally right, it's finally perfect. And then their anxiety might dip down a little bit. So that's what they are working towards, and consequently, because as we know, how long does it take to get something just right? It can take forever. So they're falling behind and or procrastinating. The child with ADHD is falling behind in their work because they are distracted. They, just by nature of the disorder, it's difficult for them to stay focused on one task at a time. So a lot of times they can get distracted and have difficulty concentrating on that one piece of work. And so we can see some of the other things here. Difficulty copying off of the board. You can see both students. I think people over here were mentioning that a lot of times their kids have difficulty copying off the board. Well, again, child with anxiety, you've got to figure out what's going on, is going to be copying everything down exactly as the teacher has it to make sure that it's exactly the same. Whereas a child with ADHD may have difficulty copying off the board because they're getting scattered and not copying almost the opposite, that they're having difficulty getting everything in because they're copying from every which way off the board. Just touching on this last one, does not have proper materials to complete their task. And again, we can see that in both children with anxiety and ADHD. So does anyone have a sense? I know we associate that more with ADHD. Okay, well, this little guy doesn't have his materials again. And I think we tend to, as mental health professionals and also as teachers and doctors, just think, okay, that's an ADHD kid that is having problems staying focused or even writing down problems, knowing to write down the assignment and what all that will entail. Or a lot of times the ADHD kid will have a lot of trouble thinking through a task to completion because breaking things down into steps and thinking it through from point A to B to finally get to the final ending point, they're going to have a breakdown there. But what about the kid with anxiety? Why might they have problems so that they don't bring all the proper materials in order to complete their task?
Preoccupation with the anxiety.
Yes, definitely.
There's no room for any details.
Mm-hmm. Or actually, there's a lot of times with the, if we're tying in this perfectionism piece, there's no room for the big picture, basically because they're completely focused on the details.
It would seem that the anxiety and ADHD symptoms, it seems like the anxiety symptoms are more internalized in the child than the ADHD symptoms. External factors are getting in the way of their being efficient in what they do, whereas their anxiety and dealing with this fear that's overwhelming, it sort of paralyzes them from being able to do the things they need to do. That's very within themselves as opposed to all the external factors.
Sure, that's a piece of it. Yeah, that is a piece of it. That's a good observation. Well, so what's happening here with the child with anxiety? They're going to be focused on the micro. of a project. So for instance, if they've got an assignment to do a model of the planets, you might have a child with anxiety who is so focused on making sure that the model is completely to scale, so that this planet is this much smaller or bigger than the others, and this distance exactly from the sun, done to scale, that they might actually forget to bring in some sort of device or wire to keep all those planets connected to each other so that they can rotate. So they've been focused on this little detail to get it absolutely perfect. And in the meantime, the big picture is we need to have a working model of the project.
That's your perfectionistic child. We can go. Okay. So we can see again that both the child with anxiety and ADHD may need extra time on tests. So I just would like to show of hands. If we did the opposite, where instead of allowing these children extra time, we said, okay, you only have, so I remember growing up, we had to do minute math all of the time, or we had to do multiplication tables within a minute, however many you could do. Which child's going to do better? The child with anxiety is going to do better. Raise your hands. Oh, I don't have anyone. One soul. There we go. Two. Okay, who says if you time the test, the child with ADHD will do better? Okay. Or maybe, guys, you're just not participating. Or maybe we're clueless.
Neither kind of child will do well.
I saw probably, a dozen hands for ADHD, a couple for anxiety, and the rest are undecided. So actually what we would see is that a child with anxiety is going to do better on a timed test. They do poorly on tests where there's a lot of time and then they wind up needing more because, again, they get so tied up in the nitty-gritty, in the details, checking, double-checking. So for that, for the math problems, if you don't have a minute to do it, you can make sure, and I still find myself doing this, if someone asks me a really simple, oh, quick, what's 5 times 20? I'm like, okay, let me do it all out in my head to make sure I'm giving you the right answer. And that's how a child with anxiety is going to be. Something that they know, if they have the time, they're going to make sure and double-check that it's perfect. If they know it, and it's a timed task, they don't have the luxury of going back in their head to make sure it's perfect, of reviewing. They've just got to spit it out and move on and move on. And I don't know if you guys have ever encountered this when you go to a restaurant and you're asked to order something from the menu and you have no idea what to order, and a lot of times I'll find myself saying, okay, well, go to everybody else at the table and then come back to me. And it's not that I'm using that extra time to make a quick decision. It's that I'm still deliberating which is the right decision, which is the right decision. And finally, when they get to me and I only have 5 seconds, I can spit it out just like that. It doesn't matter what I was thinking of in that whole time when I was deliberating. So that's the same thing for a child with anxiety. If they're forced to spit it out to make a quick decision, they can do it. The child with ADHD, a lot of times they need extra time on the test because they're going about it in a haphazard way, or they may not be processing and understanding material. And also, a child with ADHD is not necessarily going to do better on, say, going back to that example of the minute math, or the mental minute math. Because, again, a child with anxiety, if they know the answers, they're going to boom, 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 just go through and answer. Child with ADHD, even if they know the answers, it can be scattered. So they might answer the first problem, then skip down, oh, this one's easy. Then go back up to the next problem, I'm not sure about this one. Let me go 3 over and see if I know this one. And then, so they're wasting time that way.
So are those not good accommodations to give either student?
Well, we'll talk about accommodations at the end, and it can be appropriate. Unfortunately, there's not a set answer. It can be appropriate to either extend the time in either case, or in certain circumstances to make them answer quickly. So if I don't answer that when we get to the accommodations, you can ask me again.
Do you ever see that in the anxious child, since they kind of lack that big picture, that they become more obsessed with the time than just doing the task at hand? You ever see that they become more obsessed with like the time that they do have instead of completing the task?
Sure, so that can be part of it. And a lot of times what's happening there is also a problem with decision making, where when they're getting so caught up in all of the what ifs and the what ifs, and if I don't, or if I do it this way, that it's difficulty focusing on the task at hand. So again, in that circumstance, if they're forced to answer quickly, if they're given a shorter time frame, they will likely excel. Again, it's kind of a trial and error
Right.
to go about it, but that can be part of it as well. I'll touch on this last one. Talks about world events. So we were talking in here about world events a little earlier. An anxious child is going to be able to tell you that I only knew of, a couple earthquakes. Well, they're going to be like, no, there was this one and this one and this one, and here's the magnitude of each one, and here's the likelihood of it hitting Southern California, where the fault lines are. Whereas a child with ADHD, they might be talking about world events, but this could be more like blurting out something about a local sports game, the score, or something along those lines. It's probably, you'll see a child with anxiety, the world events that they're aware of when H1N, we saw a lot of kids around H1N1 that would work its way into a conversation in a therapy room. Whereas a child with ADHD, there's not necessarily a theme to it, and what you're looking for there is that it may come out at inappropriate times, the blurting, because there's no impulse control. All right, so this is now that we've talked a little bit about distinguishing between ADHD and anxiety, and we've talked a lot about anxiety and what it is, what do you do? This is why you guys are all here. So again, this was a great question, because somebody asked earlier, what do I do as a teacher? And how do you see your role as a teacher in helping the child with anxiety?
I would personally love some tools to apply kind of in real time with a child in the classroom, however their anxiety is manifesting. Not as playing a therapeutic role, not
Right.
being-
So that's important to keep in mind, and also to take some of the pressure off of yourselves. Your roles as teachers are to help the child learn. And so it's to provide the best environment possible for a child with anxiety so that they can learn. You're not the therapist, you're not the parent, so of course you want to do as much as you can for this child, but of those three, you've got the component of helping the child to learn as best they can. So keeping that in mind, what we want to do as much as possible is to keep an open line of communication with the family. Because it's not your role to step in, and it's just too much, frankly, for you guys, to step in and play therapist or mother or father. So we want to communicate with the family also, because this is really important in terms of knowing why the child is acting the way that they're acting. When we went way back to, is this ADHD or is this anxiety? Well, when you see the same exact symptoms, if you're filling out one of those checklists, the symptoms alone don't tell us. We need to actually talk to the family and figure out what's behind this, what's going on, what's the history here. And also, this is going to help the family to know how the child is doing in school and vice versa, so you can both be informed. So one way that this can be done, I don't know if anyone here does something where they send home maybe a paper or something really quick and easy at either the end of the day or the end of the week, a Likert scale. Karen has these set behaviors on a scale of 1 to 5. Today she was a 5, so she threw a tantrum. Oh, today she was a 1. She did awesome. She was helping other students. So that sort of thing, to keep each other informed. Okay, so along those lines, we want to document behavioral changes in the student, both positive and negative, because we want to know why these behaviors are happening. And if we don't document exactly when they're happening, it's much more difficult to figure out Is this because of a new intervention? Is this because of a new medication? Is this because of something that I'm doing as a teacher in the classroom that's really helpful to the student? Is this because of something completely random where there was a fight at home last night? So if we don't know, then we also, if we don't know when it's happening, then, and we're not documenting it, then it's difficult to figure out what do we keep doing because it's helping and what do we need to change because it may be harming the child or at least not improving their anxiety. All right, this is really important because as you guys know, kids are spending more time with you a lot of times than they are with their friends or than they are at home. So their lives are geared around school and especially for the kids that are still in a single classroom. As the teacher, you have a very influential role in their life. So we want to make sure that we establish rapport with the student. And there's actually been research that's indicated that in a supportive classroom environment, we actually see that anxiety symptoms will decrease, which is great because that allows when we're not engaged in that fight or flight mode, then there's more room to concentrate and actually learn. So the whole reason as teachers that we want their anxiety to decrease is because it helps you to do your job and they're able to learn better. So again, this is the same thing. If we go back to that, initial example, we have a loved one who is missing. So we're at the point now where we are, we're driving around, we're searching, we're in fight or flight mode, this loved one is missing and we don't know what to do. So we're driving around and we're going to a park and there's a lot of other parents there that say, oh my goodness, this is a really safe place. If your child was here, then chances are they're safe. Even if not, let me help you look. So that's it's not gonna get your fight or flight the whole way down until you find that child, but it is going to keep it in check. Whereas if we head into a harsh critical environment where you're going over to that park and there's no parents and there's a bunch of really seedy looking people or maybe some homeless people and it's a dirty park and there's litter all around. Okay, that's a harsh critical environment and chances are your anxiety, if it had dipped down at all, is going to peak when you head into a harsh critical environment like that and you're already on this threshold with the obsessive thoughts. So this is what we need to keep in mind with students. It's the same idea. If they're going into a classroom where they feel really welcomed, they're able to learn a little bit better. And it's the same thing if it's a harsh critical environment, which a lot of times it's not necessarily always the teachers, it can be the other students as well. Then it makes it really difficult for them because their fight or flight response is getting triggered and going right back up. So this is important, especially with those students with the perfectionistic tendencies, to note their progress based on their own achievements, and their own achievements in the past, rather than say the whole class got a B and you got an A. Because even though that seems like it's a really great thing to say, it's actually, it's highlighting where a sense of comparison for them to the other students. And it's the same thing, obviously, vice versa. If they're getting a C and the rest of the class gets an A, we want to be able to say, okay, you got a B last time, you got a C this time. Let's work through this. Or you got a D, a C is an improvement this time around. Okay, so here we go. Children with anxiety have a difficult time making decisions. And I'm sure you guys have seen this, I imagine. So this goes to, what do we do if we have a child who has a difficult time making decisions and they're taking a really long time to complete their work, a really long time to answer questions, or sometimes, has anyone here had a child that if they answer incorrectly, they'll get really upset? Okay, looks like most of you have. So one thing that we can do here is we want to give them basically practice at answering questions and making quick decisions. So it's actually just talking to a teacher about this with a child that I'm working with. He said that every time they ask this child to make a decision, she gets so upset that she'll start to cry. So the teacher said, I want to be humane. I don't want to put her in a situation where she's crying all of the time. And I said, I want you to be humane also, but we've got to up the ante here, where we're giving her lots and lots of practice at making quick decisions. And again, sort of a reminder, I'm going to throw this ball to you. By the time you throw it back, real quick, answer that question. Okay. We can go on to the next one, and then we'll open it up for questions at the end as well. Okay, so first, I want to talk a little bit about what is a behavioral manifestation of anxiety. So you guys are all here because you have kids with anxiety. What does that look like? How do you know that your child has anxiety? What are some of the things that they're doing?
Chewing their nail bed.
Oh, good. Chewing their nails.
Having full-blown panic attacks in the bathroom.
Okay, well, that's a giveaway. Okay. So having panic attacks. Anything else?
Spontaneous crying.
Okay, spontaneous crying.
Bathroom breaks, a lot of bathroom breaks.
Bathroom breaks. That's a good one too. That's a really good one because it may not be obvious.
Frequent nurse visits.
Frequent nurse visits. Good.
Sucking on their shirt, twirling their hair,
Uh-huh.
licking their skin.
All the fidgeting.
That's just me.
Yeah. Tapping the pencil, chewing on the pencils. These sorts of
Headaches during
things.
every test.
What was that?
Headaches during every test.
Uh-huh. Headaches during every test. Okay, so this is great because again, you guys are here and it's good that you're thinking and along the lines of could this be anxiety versus something else. So behavioral manifestation of anxiety, it can be anything. But we have to keep in mind, especially if you know that this child is prone to anxiety, that any behavior that seems maybe odd or quirky and or anything that may be a misbehavior, certainly there still need to be consequences and follow-up. It's important to keep in mind that that misbehavior may be due